Today we're going to talk about high-frequency, radiofrequency microneedling. This device delivers energy down deep into the dermal layers of the skin to cause tightening and collagen formation. I'm going to have Nicole demonstrate it. The beauty of this device is that all skin types can be treated. There's no downtime. The patient will leave here a little red, but that will go away by the next day. We also can infuse products such as growth factor and protein-rich plasma down deep into the channels that we've created to cause further tightening and stimulation of collagen. Typically with this procedure, we recommend a series of 3 to 4 of them, and the patient will start to see results in about 3 to 6 months after the procedure. This is a great procedure for treating skin damage, pigmentation, acne scarring, and just lines and wrinkles from normal aging. Today we're going to talk about a really exciting new procedure that we offer here at RenovoMD. It is one of our most popular procedures as well. What this is called is Dermal Infusion. What it does is it uses a diamond tip to exfoliate dry and damaged skin. It also extracts skin debris and bacteria from the skin. And so therefore it deep cleanses or deep cleans the skin. The third thing that it does is it infuses serums deep into the epidermal layer, which is possible because we've got that nice exfoliation going on. Typically we'll customize the serums depending on what the patient's concerns are. For instance, if they have acne, we'll infuse some things to treat acne. We can treat pigmentation with this, and we can also get a nice plumping of the skin, up to about 70%. This is a great procedure for aging skin, dry, dehydrated skin, enlarged pores, fine lines, and wrinkles. But the beauty of this procedure is it can also be used on other areas of the body. So typically if somebody, say, has back acne or dry and cracked feet, hands, stretch marks, we also can customize our treatments to treat that area. I'm going to have Liz demonstrate how this procedure is done. As you can see, it's very comfortable to the patient. Most of our patients will fall asleep during it. It usually takes about 45 minutes to do the procedure from start to finish. And what we're looking for is a nice, healthy pink glow to the skin. Afterwards, your skin will feel very clean. Some people have likened it to feeling their skin is glowing because it really does a nice job of exfoliating and infusion. How does it feel? It's comfortable. As you can see, she's pretty comfortable. Typically with this procedure, we ask patients to come in maybe once a month. We can do it as often as every 2 weeks. But once a month is usually what our protocol is, and that a series of 3 of these will give you a nice, healthy glow to your skin. So today we're going to talk about Botox, which is a neuromodular agent. And what that means is that it relaxes muscles. I call it nature's muscle relaxant. Botox has been around since the 1950s, and we use it now for a variety of reasons. The biggest thing that we use it in cosmetic medicine is to relax those dynamic lines or lines that occur when you're making expression. As you can see, I've marked out the patient, and what I'm using is a little tiny needle, and I'm just going to put little tiny drops of the medicine into the skin. The Botox will start to work in about 3 to 7 days, and it will be fully kicked in about 2 weeks. Most patients will get about 3 to 4 months out of the Botox, and then it will need to be redosed at that point. So now we're going to do some dermal fillers on this patient, and what dermal fillers are typically hyaluronic acid. What we do is we inject them at different depths into the skin to provide lift and volume. As you can see, I've marked the patient out as to where I'm going to inject. And what we're going to do is we're going to pull back the cheeks and lift them just a little bit, and that will soften this area as well. This filler has numbing medicine in it, so it's usually pretty comfortable for the patient. And we will give them some ice, and they can roll that on there, and it's usually very comfortable for the patient. And you can see the area is filling up nicely, and we're giving her a little bit of lift to her cheeks. And usually the patient will stay pretty comfortable throughout. These fillers will last about 1 to 2 years, depending on which filler we use, and then they will need to be redosed. Today we're going to talk about Coolsculpting. Coolsculpting is the world's #1 non-invasive fat loss solution. There have been over 6 million Coolsculpting procedures performed in the US alone. Here at RenovoMD, we have been Coolsculpting before it was cool. We have done thousands of treatments over the last 10 years. When we're assessing a patient, we're looking for areas of opportunity and where the patient's concerns are. As you can see, we've marked out this patient, and she has 2 areas of fat pockets that can be treated very nicely with the Coolsculpting. We mark out the areas, and then we use various templates to see which applicator would be the best fit for this patient. Each area is going to take about 35 minutes on the Coolsculpting machine. As you can see, this is the Coolsculpting room here at RenovoMD. It's very comfortable. The patient has been marked out as we noted previously. Nicole has prepped the skin with a special wipe and a glucose pad which protects the skin from the cold. This applicator has been chosen for this particular patient because it fits her and is customized to the area that we're going to treat. What we do is we take the applicator and we just place it on the skin and secure it with a strap or a pillow, however is the most comfortable for the patient. Initially, the patient will feel a little bit of a burning sensation, but that goes away after about 2 to 5 minutes, and patients are then free to watch TV, work on their Wi-Fi, or sleep if they want to. This procedure will take about 35 minutes. After the patient comes off of the machine, we massage it gently to break up the crystals that have formed in the cells and get the process moving. Patients will go home, they'll have minimal or no downtime. Some patients do get a little bit of bloating, some patients get nauseous or a little bit of tingling and numbness. That is usually transient and it will go away within about 24 hours for most patients. We then have the patient come back in 3 months so that we can reassess and see the wonderful results that they got.